All right, good morning. It's Lupe, Classic Hits, 92.7, 95.3. We're talking menopause and bioidentical
Yep, hormone replacement
therapy. I got that right.
That's right.
Even for a jarhead.
Very good for a jarhead.
Yeah. And I can say that because you were in the Marines. You're still always a Marine.
Once a Marine,
obviously,
always a Marine.
from what I just found out.
Yep.
Dr. Jacqueline Russell, D.O., is a board-certified family physician. She is a Marine Corps veteran. She earned her Doctor of Osteopathic Medicine from the University of New England College of Osteopathic Medicine.
Yep.
Biddeford, Maine. Dr. Russell provides full-spectrum outpatient care and manages patients' care across the lifespan from pediatrics to geriatrics. Good morning.
Good morning. How are you doing?
Good. It's awesome that you're here.
Yes, thank you very much.
So what are the most common symptoms of menopause, and how do they vary from person to person?
Well, menopause, back up a little bit, menopause can start anywhere from 48 to 60. And most women are told that this is just another phase of life. You're going to have to get used to it. And there's nothing really that they can do for it. Before the WHO research in 2002, they used to give hormone treatment, which was called HRT. Back then, it was all synthetic hormones. So when they did this research, they came back saying that it caused blood clots, you got to be aware of it, and can cause breast cancer. So that scared a lot of people from giving any HRT treatment, any hormone treatment. So a lot of women have suffered with the symptoms, which are insomnia, anxiety, mood disorders, skin disorders, a lot of muscle pain, joint pain. It's not just hot flashes. There's a lot of things that can happen to a woman after they go through menopause. And it can be either not affect them at all, and it can also put them in the hospital. A lot of women are put on benzodiazepines, Ativan, things for anxiety, SSRIs, antidepressants, when really all they needed was hormones. In the last few years, they have had bioidentical hormones come to the forefront, which do not cause any of those. They do not cause breast cancer, do not cause blood clots. They actually lower the risk of blood clots, lower the risk of cancers, especially breast cancer. They lower the risk of dementia, cardiovascular disease. They're very healthy. They're very good for a woman to take. So recently, about 3 months ago, the FDA took off the black box warning for hormones, saying that, we have found that we made an error. It was a mistake. Women should be able to have hormones, and we should not limit them. So I really wanted to come out here today just to let women know that BHRT, bioidentical hormone therapy, is a good thing for you. It can really change your life, help your life, and help you enjoy the next 40 years and not just wish you were 40 years younger.
Now you may have talked about it a little bit, but talk a little bit more about the differences. How do you do that?
The differences between the hormone therapy?
The different hormones and the traditional one.
Sure, yeah. The traditional hormone therapy was Premarin, Provera, progestins. They're all synthetic hormones. The Premarin specifically came from horses or mare urine. And so we're taking estrogens from a 1,500-pound animal that has over 11 different types of estrogen and giving it to a female, a human female that weighs about 100 to 200 pounds, and they only have 3 types of estrogen. So it does cause some issues, and the progestins are totally synthetic also. Bioidentical is made from yams or soy, and they are identical to the actual molecular level, that you have when you're a younger female. So it's estradiol, progesterone, and testosterone.
And it is all taken the same weight, though?
The estradiol can be given orally. That's the most beneficial is oral estradiol. That helps your cardiovascular system and helps you prevent osteoporosis also. The progesterone is also given orally at night, and testosterone is best as a topical cream, or you can also do injections. a lot of people are familiar with men doing testosterone injections. And again, men do testosterone, bioidentical testosterone, and it is not the same as synthetic testosterone. It does not cause road rage. It doesn't cause, a lot of the negative side effects.
Okay. And you're involved in that also?
Oh yeah, definitely. Men and women.
Okay.
We didn't have that much time today, so we were just gonna
focus on
the women. Yep.
So what are some side effects for BHRT?
So BHRT. So let's say you start estradiol. Oh, also estradiol can be given in a patch or a cream. Some women who have suffered breast cancer in the past are very reluctant to do any oral estradiol, mainly because their oncologist doesn't want them to do any hormones whatsoever. It is safe for them to do patches and cream. Okay, so that is available. And some of the side effects of estradiol, if you start too high of a dose, you can have what they call the 5 Bs. It's bloating, bleeding, bitchiness. Can I say that on the radio?
Yes.
Okay. And
you just did.
And breast tenderness. I think that's only 4, but I can't think of the last one. And so what you do is it's simple. You start at a lower dose. Everyone's a snowflake. Everyone's needs a different level for their body. The progesterone, when you start progesterone at night, it can cause sleepiness, somnolence, which is one of the benefits also. But if it's too much progesterone, then you can be sleepy past the morning. So you just cut back on it a little bit. The main side effect of progesterone is nipple tenderness, but that usually goes away just with continued use. Testosterone has many good side effects. The negative side effects that it can cause are for women is a little acne. It can also cause them to have a little more hair on their face or arms and might thin their hair. But we give them a medication called spironolactone, which fights against the testosterone receptors in those areas, so it doesn't happen as much. So there's a way to do it. Testosterone also comes in pellets that they can have put underneath the skin. And like I said, they can also do the injections.
Okay. So how is it determined by individual? How's the dosage determined?
So generally, we first we'll get a panel of labs for all the estradiol, progesterone, testosterone. There's also DHEA. And an FSH-LH can be done to tell if they're really in menopause. The levels will tell us that. And we start low, go slow. The older the women are, the lower you want to start the estradiol and the progesterone because it's the longest they've been out of it. So it's like you can start a BHRT regime in an 80-year-old. There is no time limit. That is another myth from past use of the synthetic hormones, is you could only do it when they started in the 50s to the 60s, and then you didn't want to start anybody after the age of 60. There's reasons for that we can go into if we have time, but that does not apply to bioidentical hormones. You can start an 80-year-old on hormones, and I have started 80-year-olds on hormones and had very good results. So
that kind of covers a little bit the specific health conditions. Like, are there specific health conditions that would make BHRT unsafe or recommended for recommendation?
Not really. However, if you had breast cancer, per se, the oncologist, so when you're dealing with more than one doctor for anybody, and one doctor says, oh, I think this is really good, you should get on this. The other doctor might say, oh, no, I think this is really bad. You should get off this. So it gives like this push-pull. And it's been most oncologists' theory that no hormones if you have any type of cancer because it's going to make the cancer grow. However, what they don't tell anybody is they used to treat breast cancer with testosterone. They don't do that anymore because, pharmaceutical companies don't make any money from the testosterone. They make a lot more money from the medications that they give them now. So they don't do that anymore. However, I would say breast cancer would be one of that, and there might be some off. There is one that is hormone. It's a rare disease.
Okay.
So it's not very common. Most women should have no problem taking BHRT.
And how long can they be on that?
Forever. You're on it forever.
Okay.
You're on it forever. It's not for the shortest time possible. You're on it till you die.
Oh, wow.
Because once you start it, if you feel good, you stop it, you're going to go right back to where you were.
So, and it's safe to do that?
Yes.
Okay.
Oh, you mean to stop it?
Yeah.
Yeah, it's safe.
Well, no, I mean, like it's...
Oh, stay on it forever?
Yeah.
Yeah, very
okay.
safe.
Okay. Now, what forms of BHRT are available, and how do they compare?
So you have the choice of oral, estradiol and progesterone, and you also have pellets of estradiol and testosterone that you can have just placed underneath the skin. You can also do injections for estradiol and testosterone. Progesterone, really, the only way to take it is orally because it's not very bioavailable through the skin or the mucosa. So you really want to take that orally.
Now, can lifestyle changes reduce menopause symptoms enough to avoid therapy, hormone therapy?
For some women. Some women in their 90s have never taken any therapy at all. They feel fine. They're great. They wouldn't want to change anything. Lucky them.
Yeah. So that some of that could be genetic.
Yes, a lot of that is genetic.
Genetics, yeah.
Other women, they like if they have a hysterectomy and they remove the ovaries, they're instantly it's life changing. They feel horrible. They need the hormones. They will feel better on the hormones. I've only had probably 2% of the people that I have treated not want to stay on the hormones because they've had negative results where they feel like it just made them feel bloated or more tired. And hormones, I believe they make everybody feel better. Sometimes you have to work a little harder working on dosing to do that, but you don't have to take it. It's not imperative that you take hormones. However, if you do take hormones, it is very beneficial for the cardiovascular disease, for any cardiovascular disease. It helps prevent Alzheimer's, osteoporosis. Even women with osteoporosis can start taking testosterone, estradiol, and progesterone, and they can reverse their osteoporosis. So it's a good thing.
Yeah. So women need a mixture of the estrogen and testosterone.
Yes.
So that's what that.
Yes.
Okay.
Men need about 400 milligrams of testosterone a day to feel good. Women need about 5 milligrams. It's very small dose.
So how do healthcare providers monitor progress and adjust the BHRT over time?
Patients come in and they just let me know how they feel. If they feel good, they feel good. We don't have to increase if they're at the level of happiness that they want to be at. I mean, if they feel like it's doing everything for them. If we're trying to fix something like, let's say, osteoporosis, we want their levels to be the highest that they can be. So we would want their estradiol level to be at about 100, and their progesterone to be at 10, and their testosterone to be 300 to 600, let's say, supra pharmacologic levels. Or pharmacological.
I have no idea,
yeah.
so
I
wouldn't know.
So then we would...
Hopefully you're getting it right.
Then we would test them. But normally, once you start them, when they get to a point where they feel good, you can stay at that level.
Right there.
But if you're looking to make changes in their body, then you want to make sure they're at the good levels. So
how can we get a hold of you?
I work at St. Croix Regional Family Medical Center up in Princeton, and also in Calais. We have a satellite office, and just call. And I can also see people just for hormones. They can keep their regular primary care doctor, and we can just do hormones.
Sounds good.
And it's a lot cheaper than going to a hormone company or facility that just does hormones, because you usually have to pay them a membership fee and everything that comes along with it.
And where you are, they have a sliding fee.
Yep, they have a sliding scale. Yep.
Sure now, how long have you been there?
I started there in November, so about 6 months.
Okay. And where are you from originally? Or
Florida.
Florida.
Yeah.
What part of Florida?
Sarasota, Florida.
Nice. I'm from West Palm Beach, Florida.
Are you? West Palm is beautiful.
Yeah. Some areas.
Yeah.
Yeah.
Well, yes.
Yeah.
Some
Yeah,
areas.
Yeah, some areas.
That's true.
Palm Beach is very nice.
Yeah, that's true. Sarasota is also gorgeous.
Yes. Oh, Sarasota. That's.
But I love Maine, and I.
Oh, me too. Yeah.
Since I went to med school here, it just
Okay.
for me it made sense to come up and practice up here. Love the people.
Sounds good. Thank you.
Thank you so much.
Dr. Jacqueline Russell, DO.
Thank you very much.
For joining us. Nice.
Have a great day.